Well, good afternoon, folks. Thank you for joining us on at least what in Baton Rouge is a rainy day. I hope it is doing okay where you all are. It's good to be with you all. My name is Michael Tipton. I am president of the Blue Cross and Blue Shield of Louisiana Foundation. We appreciate you joining us today for our fourth and final session focused on healthcare human capital. A few housekeeping items. I'm sure everybody is quite familiar at this point with Facebook and Zoom, but just a reminder for our presenters, if you don't mind keeping yourself on mute, except when you're presenting, just helps with background noise. And for all of our attendees, you are welcome to chat your questions in the chat box. For those on Facebook, you are welcome to comment those questions. We'll be answering them as we go. So to dive into some context, when we envisioned this session a number of months ago back in the spring, we were hopeful that COVID might be increasingly a memory of the past. We were hopeful that we might be able to get some folks together in person and really focus on long-term issues. Obviously, COVID has not left us, and hurricanes like Hurricane Ida just a couple weeks ago have certainly made us all focus on the immediate response and recovery needs of our state. That is understandable and right in the way that we respond when Louisiana faces challenges, but it has also meant that for our attendees at these sessions, they may have internet issues. They may not be necessarily able to focus on all of those long-term things. That is part of why we're recording each of these sessions. We are glad that people have been watching them after the fact and following up with questions. That's the nature of the current world we're in. We are glad that folks are able to do that courtesy of Facebook and other dynamics. And so certainly, whether you're watching this live with us today or whether you'll be watching this a couple weeks from now, we're glad you're here. And we certainly look forward to you all engaging in this topic. And part of why we decided to push forward on these key critical topics is we know that before the pandemic, it was difficult to find a nurse or mental health provider that you might need. That became even more painfully clear during the pandemic. Our state has something like 6,000 frontline healthcare workers that it is requested in terms of help. And certainly we know hurricanes and other disasters make that all the more challenging. So all that is a long way to say that while the circumstances of this set of sessions weren't ideal, we think it is critically important, and we are glad you all are taking the time to join us. We've structured these sessions, the last three and the one today, sort of as a TED Talk approach. We're not aiming to get into all the details, but rather to spark ideas, to have ideas spread throughout our state, and ultimately to encourage follow-up and engagement. So I would encourage, as you're listening today, think about whether these concepts might be right for you or your organization and your community. And if they are, please let us know how we can help. So to recap where we've been and where we're going, this is the final of 4 sessions, which we held each Tuesday in September. A couple weeks ago, we started with an overview from the U.S. Department of Health in terms of the healthcare landscape. From there, we discussed pipeline issues with recruiting and retaining and graduating people. Last week, we discussed the interconnectedness of issues. And today, we're going to be looking and hearing examples of how cross-sector partnerships can make a real dent in some of the issues that we are seeing relative to healthcare human capital. After each session, including today, we're going to be asking for your feedback. And specifically after today, we're going to invite you to potentially engage with partners on these topics based on geography, based on focus, to hopefully engage and do the work that is called for down the road. So to set the framing for today's session, Jonathan, if you could pull up the pipeline graphic. A few weeks ago, we discussed the fact that in America and in Louisiana today, we are certainly short in terms of the numbers of doctors, nurses, dentists we need. And frequently when we talk about those issues, we think about them as a pipeline, that we don't have enough people applying, maybe we're not graduating folks sufficiently to get to where we need. But Jonathan, if you could pull up the social determinants of health graphic. As we discussed following that, we know it's not that simple. Those nurses, those doctors live within a context where there are real economic choices, where there are real personal choices. Our patients and individuals live within a world where the social determinants of health, what is up on the screen, influences folks to make a variety of systems. And so whether it's questions of diversity, equity, funding, operating in the silos, as we discussed last week, these issues are nuanced. And then if we could pull up our complexity graphic, and that's not even beginning to take into account the fact that when we start thinking about healthcare policy or people's lives, it's complicated. This graphic was actually produced as a flowchart to explain how the Affordable Care Act and some policy updates would work. I could pull up a variety of other graphics that you all have seen, indicating how people make healthcare decisions or how healthcare is paid for. Needless to say, it's complicated. We can pull that slide down. So I say all that to say these are complex issues. And it would certainly not be unreasonable for people to throw up their hands and say, you know, this is too big, it's too complex, it's not clear how we can address it or that we can really make a dent. But as we've seen over this last few weeks, there's plenty of evidence that we can really move the needle on some of these issues. And as we're going to discuss today, we think we can do more when we work together in multi-sector or multi-partner efforts and where folks come together to address big issues. So today, we're going to hear first from the Northeast Louisiana Healthcare Alliance, led by the local Workforce Development Board in partnership with healthcare, higher education, and industry leaders. As they'll admit, they aren't perfect, but they've built a pretty competitive cross-sector partnership that's really starting to address issues related to the nurse shortage and a variety of other challenges. Following that presentation, we're hopefully going to have time for some Q&A for them. And then we're going to hear from 3 leaders across our state, one from a major university, one from a major business, and one from a major healthcare institution about their experiences addressing healthcare human capital. They're going to share their reflections from their own work and how they believe that we can address these issues going forward. Hopefully from there, we're going to have time for some questions for everybody. And then we're going to close with some wrapping up thoughts and some more details about how you all can engage. Short answer is you can fill out a survey and tell us you're interested, and then we'll help connect you with other people across the state who are interested in these topics. So without further ado, let's dive in. Terry, Shay, Jonathan, I would love to have you on the screen. Today, we're glad to be joined by Terry Mitchell and Shay Cheatham of the Workforce Development Board 83. The Workforce Board is helping to lead the Northeast Louisiana Healthcare Alliance. We're also joined by Jonathan Phillips, who's now Director of Clinical Services at LaSalle Corrections, but previously was leader of one of the hospitals in Monroe and an early leader in the Northeast Louisiana Healthcare Alliance. They're going to share more about this partnership, how it came to be, how they're doing so far, and what they're planning to do going forward. And as I said just a minute ago, I hope you all will be thinking about whether something like this might be applicable in your community. So with that, Terry, the floor is yours. Thanks for being here.
Well, thank you. Well, thank you, Michael. We appreciate the opportunity to speak with this distinguished audience and share a little bit about our experience with the Northeast Louisiana Healthcare Alliance. Let's go to the next slide, please. First, we'd like to give you a little bit of history about who we are and how the healthcare sector partnership was developed. As Michael mentioned, I'm the Executive Director for Workforce Board 83. Workforce boards are created by federal legislation under the Workforce Innovation and Opportunity Act. We are an employment and training agency that serves both job seekers and employers. Most of you know there are 15 workforce boards across the state, and these workforce boards are required to have 51% business and industry representation on each of them. So our workforce board is a 10-parish consortium in the northeast corner of the state. We serve the 10 rural parishes surrounding Ouachita Parish. So our workforce board is a bit unique. We are an incorporated 501c3 nonprofit board. And most boards, however, operate under the parish government in our state. We are a part of the Region 8 labor market. And so we partner with WDB 81 serving Ouachita Parish for all regional initiatives. So just to give you an idea, workforce boards are charged with oversight of the workforce system in each of our local areas. This includes, among other things, management of the one-stop centers known nationally as American Job Centers. But in addition to providing services for job seekers and employers, the WIOA legislation requires workforce boards to create regional strategies to address skilled labor and talent pipeline needs, business and industry in our communities. And one strategy utilized by workforce boards across the country is the development of sector partnerships. So in August of 2016, Workforce Board 83, along with its partner, launched the first sector partnership in Louisiana, and namely a healthcare sector partnership. Next slide, please. So what exactly is a sector partnership? So sector partnerships are industry-driven, community-supported organizations that bring together companies from the same industry in a shared labor market region in a community. It includes support partners from education, economic development, and workforce development organizations. If you notice in the diagram, the business is at the center of the table and drives the agenda. These business representatives are CEOs and business executives with decision-making authority. And behind the little white circles are the community support partners I mentioned earlier that come alongside industry to address the needs. The little yellow triangle is the convener, which is a neutral party that organizes and facilitates the meeting. So I, along with Shay Cheatham, serve as the convener for this partnership. The key factors for success of a sector partnership is that the community support partners are all in the room and they're hearing the issues that business presents at the same time, but they are required to check their own program agendas at the door. And what's remarkable about this process of building a good sector partnership is that those industry partners come together rather readily. We on the workforce board side of things tend to get nervous about creating another workforce outreach initiative. Some of our reservations were, well, these companies, they're competitors. We can't ask them to share proprietary information. They really don't have time, especially in COVID. Who has time to meet another meeting? And we already asked them to do so much. But the reality is, when you ask companies to come together and you facilitate a discussion with CEOs and company executives around what's going on in their industry, and you ask questions like, or make statements like, tell me about your opportunities and challenges, or tell me about the growth potential for healthcare in our area. And one of our favorites we like to ask is, what's keeping you up at night? You very quickly get a shared agenda driven by those industry partners around the table. It is an agenda created by industry for industry, and the key word is shared agenda. We stay away from competitive issues. One provider puts something on the table and there is not a critical mass of industry partners interested in committing their time to the issue, then we table the topic. What keeps our industry partners engaged? They must find value in the process and see results. We are better together. You'll hear from one of our industry champions at the end of the presentation, and you can get his take on why he values this partnership. Sector partnership is a collaboration which is industry-led and community partner supported, but it leads to maximizing and leveraging resources for human capital development and increased capacity for problem solving. Sector partnerships also help eliminate silos for community agencies. We work together to develop solutions that fill the gaps. Next slide, please. So one of the first things the healthcare providers did after we launched our partnership was to create a name as well as branding identifiers. So the name they chose was the Northeast Louisiana Healthcare Alliance, or NELA Healthcare Alliance. And it represents over 40 diverse healthcare organizations in Northeast Louisiana. So hospitals, long-term care facilities, skilled nursing facilities, hospice, home health, and other agencies. But I want to mention that no one organization is more important than the other. The partnership is fully supported by community partners, K-12 education, universities, community college, chambers of commerce, and other economic agencies, as well as workforce development boards. The Alliance in Region 8 is the go-to for healthcare providers to bring and solve shared non-competitive issues, including workforce issues, networking opportunities, and pressing policy topics that warrant collective action. We're going to share a few of our highlights or our wins in just a bit later in the presentation and show you some of our action items. We are a nationally recognized sector partnership, so these are all over the country. But in 2019, we were recognized and awarded the International Economic Development Council Bronze Award. And in 2021, we were fortunate to be a part of a national sector partnership benchmarking profile case study. So we were one of 6 partnerships highlighted across the country. And I'd love to share that study with anyone that's interested. So just contact me afterwards and we'll be glad to share that with you. Next slide, please. So here are our current working committees. This is where the rubber meets the road and the real action takes place. So the steering committee actually sets the agenda and keeps the partnership on track. When we originally launched and this committee was formed, it was actually called Make This Partnership Work. And they're still doing that today. The next committee is the Education and Training Critical Occupations Committee. Here they identify and prioritize critical occupation shortages and inventory existing education programs and see where we need to fill some gaps. The next one is the Policy and Regulatory Committee. This committee identifies problem points with existing regulations that prevent healthcare providers from hiring or retaining good employees and cultivates policy advocates for change in local and state regulations or policy that limits or restricts quality health care. And then finally, we have the Post-Acute Care Committee, which you'll hear a little bit more about in just a minute. Not on the list was the COVID Recovery Committee. This was a very active committee last year. We did such things as develop a community awareness program, and it was very dynamic. But in May of 2021, our industry partners kind of felt like, oh, we had a handle on this COVID thing and it's declining. And then, as we all know, the Delta variant hit and bam, we were back at it. Next slide, please. And now I'm going to turn it over to Shay to share with you some of the Alliance accomplishments that help bring trust and value in this partnership. So Shay.
Thank you, Terry. Next slide, please. Oh, I went one too far. I'm sorry. Hold on one second. We can go ahead and go back one, please. Okay, over the past 4 years, there have been 19 successful initiatives related to the healthcare industry in Northeast Louisiana as a direct result of the Northeast Louisiana Healthcare Alliance. We have been able to accomplish a great deal as a group that otherwise would not have happened. One of our biggest wins to date has been our Adjunct faculty sharing project. In addressing the nursing shortage, it's really been very interesting. Everyone had their own ideas of how this could be addressed, but the nursing shortage was identified as an issue from one of our very first or second meetings, but we didn't actually attempt to address it until a few years in. I think that speaks a lot to the size of the issue as well as the trust that was needed amongst our partners. But because of this unique collaboration, competitive schools and healthcare providers came together to create an innovative solution. They were able to recognize that the need was bigger than just one school could satisfy, and that all of the providers were experiencing the same shortage in staffing issues and still are. Next slide. Due to the collaborative efforts and funding from Blue Cross Blue Shield and the Living Well Foundation, to date, we have an adjunct faculty pool of 17 that was non-existent prior to the adjunct project. 140 additional RN students have entered nursing school that would not have been able to without this project. An additional 34 RN graduates are now in our community, with more on the way this December and May. And we have 3 adjunct faculty that have transitioned to full-time teaching faculty. Next slide. And because of the success of the Adjunct Faculty Project, the Alliance gained confidence in working together to address other non-competitive needs. A more recent example of this has been the work of our Post-Acute Care Committee. We had several Alliance members form this Post-Acute Care Resource Committee, and the purpose of the committee was to facilitate efforts of case managers, social workers, patients, and families as they navigate post-acute care needs. Many factors are involved when choosing appropriate post-acute care placement, such as location, services provided, insurance accepted, and other factors that have to be considered. So the committee decided that, this was a need, so they got together, created a questionnaire, sent it out to our alliance members, and began the process of collecting this information. Next slide. Once the committee had the facilities capabilities gathered together, they had to decide how to disseminate this information and make it shareable with case managers initially, with the hopes of making it available to the community in the future. This led to the creation of the Northeast Louisiana Healthcare Alliance website. Next slide. Case managers are able to access the website to complete the resource questionnaire, as well as to review or view the participating facilities through the resource tab or spreadsheet or map. Next slide. Many facilities are also sharing the website with their patients and the patients' families so they can make informed decisions regarding their next level of care. Our website is a constant work in progress, but is evolving to meet the needs of our partners, and we would love it if you would like to visit. It is www.nelihealthcare.net. And I'm going to turn it back over to Terry so she can share some more of our recent work with Hurricane Ida.
Next slide, please. One last example of the value of our healthcare alliance came, as Shay said, with Hurricane Ida in a medical relief coordination. So our Civic Center had over 600 evacuees. 2 additional recreation centers were established and housed 200 evacuees. And both of these had limited medical support. And the Civic Center, it was non-existent medical support, to be honest. The recreation centers were managed by the American Red Cross, and they had a doctor and his wife who was an RN to provide medical services. So when these evacuees arrived Sunday evening, August 31st, a team of faculties and students from ULM's VCOM Medical School, the Nursing School, the Pharmacy School, and Louisiana Delta Community College's Nursing Department assisted in triage and assessment of each evacuee. The following day, these teams provided all medical care, which included a COVID unit. As you can imagine, in the hurry to evacuate, these traumatized individuals came without prescriptions and proper medical equipment needed for day-to-day living. The Alliance received an SOS call for support from the mayor on 9/1. By that morning, the mayor quickly realized that this medical response wasn't sustainable. The VCON medical instructors, doctors, and their nursing instructors and their students had to return to class. So he reached out to me and gave me a call and said, hey, can the Alliance do something to help us out? So I put a quick Zoom call invite out to our Alliance members for Friday. And if most of you know, you like to have your schedules planned out pretty quickly, but we were fortunate to have over 25 healthcare providers join the call and the mayor for him to share the situation and ask for assistance. So really what came from this meeting was there's a need to establish a schedule for rotating daily medical staffing where our Alliance members could fill in the gaps. So when a nurse got off of her shift, she might sign up to run by one of the shelters. And then the second need was for medical supplies. So the Civic Center had no medical equipment. So when the students and the doctors and instructors came in to do their triage, they had to bring their own backpack full of Band-Aids, Tylenol, blood sugar kits, etc. So the Alliance is not the disaster relief team. We were there to support and fill in the gaps. And following the meeting on Friday, Jonathan Phillips and I met with the shelter leadership from the city, the Oklahoma Disaster Relief Team, which was managing the Civic Center, and the American Red Cross to develop a sustainable plan, which included volunteers from our Healthcare Alliance. Fortunately, all the evacuees were moved closer to their homes by the following week. What we learned from this event is there's a great need for the Alliance, along with our partners, to develop a crisis support plan for our next disaster. The planned next steps are to join our partners from the university, medical school, and community college to begin working with the city to do an after-action review plan so we can develop a stronger community disaster response for future events. Just shows that the connectivity and networking opportunities with this partnership through the Alliance establishes a system for responsiveness to both healthcare provider needs as well as the needs of our community. And we appreciate the opportunity to share our successes with you. And next we have Jonathan Phillips, as he's on the call, and he is one of our greatest champions for our healthcare sector partnership. And I want him to give you a little perspective from a healthcare provider standpoint about why he values this partnership and stays engaged. Jonathan?
You're on mute.
Okay, there I go. I'm sorry. Okay. I appreciate everybody taking time from your busy schedule to allow us to come and talk to y'all today. So much has been said by Terry and Shay, and it just shows the value that we have in the conveners with workforce development, sort of bringing this together and being the sustaining force in the middle of it to make sure we stay on task and have these committee meetings and do the things that we need to do to give the most input that we can have in a short period of time, because we all are working and do have other responsibilities that we have to do and deal with every day. From my perspective, as from the healthcare side, I think a couple of things that I believe that has made this so successful is, as discussed earlier, it is industry driven. It's not just your acute care facilities. We've branched outside of just hospitals, as they spoke about already today, about post-acute care with home health and hospice and so many other things, industries that in healthcare that come to the table, and our number just continues to grow. And as it grows, it just brings a list of people that at any moment they can play a part in, just like she had talked about in this response with the hurricane. It makes quick access to a lot of healthcare people that can respond quickly to try to do things. But at the same time, for the industries to stay involved, there has to be something there for them. And they have highlighted a few of those. There's several more that we've done that we could provide to any that may be competitive. Then we have found that leads down a road that you don't have as much success. So we try to have consensus that it's always things that everybody needs to deal with and can gain from. A lot of that ends up being workforce type issues. The other thing is, I think that's made it very successful is that we don't just have the healthcare facilities at these meetings, right? So it's a support group that's there. So at most of these main meetings, you have members there from the Chamber of Commerce, the mayor's office, multiple economic development groups, workforce development, along with all our universities and the community colleges at the table. And so when you do that and you bring all this support around it, sometimes as the healthcare entity, you don't know all the resources that may be out there, the grants that may be available, that goes outside of the four walls that you deal with at your facility. So by bringing these people in, it's very helpful in being able to define where are the things that we need to work on, but who can help us do that outside of just in our own facility each day. So these are a lot of the things that I think has made this very successful, and it's a wonderful thing. The Hurricane Ida just, like you say, just made a big example of that when there was a need for all these people that needed certain things, and members of the Alliance went out there and made some rounds from their own particular entity. And they said, hey, an example is one of the hospital CNOs said, this person they had follow-up with hospice at their home, and they probably need something related to that now while they're here in the Civic Center. And with she knew with one call to the Alliance, to Terry, we could get connected to the hospice entities in our community. And in a very short period of time, not only did a hospice representative take the call, but was at the Civic Center and helped take care of that patient. One call made all that happen. So that just shows you another reason to have this alliance where your members can come together and create a group that, along with the convener, that can bring the right people to the table at any given moment. So thank you for your time.
Well, we appreciate the opportunity to share. And if Michael, if we have time, we are available for questions, or is whatever you want us to do.
Sounds great. Well, thank you, Terry, Shay, and Jonathan. I appreciate it. There's one or two questions that have come in that we'll get to, and then we'll hear from our other speakers here in just a second. The question that I've seen a few folks ask is, you all have created something, obviously it's multiple years old at this point. There's a lot of partners. The version that you all are living today obviously isn't what it started to look like. So if I'm in a community where certainly collaboration may be beneficial, but it doesn't exist or doesn't exist like this yet, sort of a two-part question. What are the first steps, and who are the entities, be they business or workforce board, what are the entities you all think absolutely need to be at that first round of conversations to make sure that something can keep going?
Okay, great. So we follow the next gen model of sector partnership, and they have a full toolkit to help you use that. But the first thing we did was we created a community support outreach. We first had to identify what sector we were going to go with, and it turned out to be healthcare because they are the #1 employer in our area. And for a multitude of reasons, we went with healthcare. But we did have the community leaders together and said, look, we want to start a partnership. Can you commit to being a partner to this group? We want to help business and industry, but you have to be willing to check your agenda at the door. You know, we all are community partners and we all have program rules that we're trying to push off our menu of services, but it's not about that. It's helping our industry grow. So that was the first step. The second step was we recruited 5 workforce champions from industry that has a good reputation in the community that could draw others in. So they sent the invite to our industry in our region and said, hey, we're going to start this launch. We would love for you to be a part of it. We have the support from our community partners. Please come. So that was how it was launched. And I hope that answered your question. Shay may have something to add.
I just think for the convener, the more neutral someone is, the better off it is, and the easier it is to sustain and get people to join in.
Great. Well, Shay, Jonathan, Terry, thank you so much. Hopefully we're going to have time in a few minutes for more questions for you all, but just to draw a connection for anybody watching, you all illustrate the way that you have multiple sectors working together, and that multiple sectors working together enabled you all to find funding, to overcome some challenges, to sort of bring together unique constellations of people to address a nursing shortage, but to also address other challenges. And certainly that's the sort of thing that, while it may not be exactly this model, we certainly want to encourage others to think about for addressing in their communities. So we appreciate you all sharing your example. And certainly, folks, if you have questions, go ahead and drop them in the chat and we will get to them here in a bit. Next, we have asked 3 leaders from across our state to join us today. And these are great folks who have their own backgrounds. And specifically, we're asking them to speak about both what they and their organizations have done, but also as a sector leader, because we think certainly when you talk about addressing healthcare human capital, we know it's going to involve healthcare. We know it is going to involve higher ed. We know it's going to involve business and probably lots of others. So we have one leader from each of those sectors here to join us today. First, we're going to be hearing from Dr. Tina Holland. Dr. Holland is the president and CEO of Franciscan Missionaries of Our Lady University, FranU, which started as a healthcare training and education institution and continues today as a full university with a variety of backgrounds and topics that folks can be trained in. Dr. Holland has been a leader in this space, and certainly FranU has worked with a number of partners we've heard about in this series, the Baton Rouge Youth Coalition, the Baton Rouge Clinic from earlier in our sessions. Dr. Holland serves on a healthcare workforce commission to address this issue statewide, and certainly is a very thoughtful leader in addressing these topics. So Dr. Holland, thank you for being here today. And with that, the floor is yours.
Well, thank you very much for having me. I'm going to share my screen here just to sort of facilitate in our discussion. And I trust that that's up.
I'm not seeing it yet, but
hold on. Let's see. There we go.
There we go.
All right. Thank you very much. So, very briefly, the mission of our institutions to educate and form servant leaders, primarily in healthcare and related fields. And it's important to note that we do more than ensure professional competence of healthcare providers and others. We teach them to think and understand the importance of being active and contributing members of the community. And the university's curricula includes both clinical and non-clinical programs because we tend to look at supporting the needs of healthcare in its really broadest sense. And we focus on the current needs of the community while also making sure that we're adapting to the longer term strategic needs and not always being reactive. And in so doing, we teach our students to be adaptable as well so that they can remain marketable. And that often means that they're going to continue in their education beyond whatever benchmark they've set out to achieve originally. And then our programs are also developed in close collaboration with the community. We never start a new program unless there's a stated and verifiable need. And we work very closely with our hiring organizations and with other educational partners so as not to be duplicating or competing when there's no need for that competition. When somebody's doing it and doing it well, then we want to find out how we can enhance meeting the needs rather than compete with others in meeting needs. And so what is it that we need? What are some of the most critical workforce needs that we think are facing our state? Well, at FranU, we believe in the broadest sense, Louisiana needs people who know how to do their jobs and who are able to think critically and creatively and who know how to behave with decency and moral integrity. We want to develop professionals with those so-called soft skills, those transferable skills that make them flexible, adaptable, and able to meet changing demands. But more specifically, as we've heard, we need nurses at all levels, respiratory therapists at both associates and the bachelor's degree, plus respiratory techs, medical lab techs, as well as bachelor degree medical lab scientists, advanced practice providers, especially in primary care, nurse practitioners, PAs, telehealth professionals at multiple roles, mental health professionals in multiple levels and specialties, senior services, as we saw, especially during the COVID pandemic, are in tremendous need. And of course, surgical support professionals, everywhere from surge techs all the way up to CRNAs or nurse anesthetists. So the common theme here is that there's multiple fields at multiple levels and in multiple roles. So disciplines, roles, and levels. So it's as you saw in the schematic, very complex needs involved here. And so what's our approach? We tend to take a very human approach. We're not looking at healthcare professionals in a manufacturing context. In other words, we're not just manufacturing talent through some industrial style pipeline of workers. We like to engage students in a process of vocational discernment before they actually enter college or a post-secondary training program. So for example, as Michael had mentioned, FranU's joined with the Baton Rouge Youth Coalition, Baton Rouge Clinic, in a healthcare's fellows program that introduces students to a serious and structured way of discerning their vocation in life, of trying to determine what is their call. And because we believe that it's through that call that they'll actually be successful. And once they enter the workforce, they need to be challenged with ongoing education to continue to meet the needs of healthcare and to continue to grow professionally. And a perfect example was at the last orientation this past fall, I met a young CNA who's a certified CNA from one of our from our local community college that had partnered with a local hospital. That hospital then, after supporting their CNA certification, saw that the potential and the high performing capability of this student and said, hey, we're going to support your BSN while you attend FranU. And I would imagine that in several years, after some clinical experience, we're going to see that student in our FNP program. That's the kind of thinking I think needs to go into meeting our healthcare personnel needs. And there's a new reality in the expectations of workers. Gone are the days where you're going to have a bedside nurse who's going to be that bedside nurse for the rest of their career. And also gone are the days where your typical student is coming right out of high school and is going to complete the 4-year degree in some uninterrupted, very traditional fashion. So we need to understand and adapt to this reality. And another example would be, LCTCS and FranU entering into a statewide agreement in order to establish well-defined series of on-ramps and off-ramps so that they could come in and out of the workforce or even and stay in the workforce with some accommodations and continue to increase their level of license and then perform at higher levels within the organization. And so, these kinds of partnerships require close collaboration like we've heard about today. And those collaborations have to be between and among all levels of educators, but also between and among educators and healthcare organizations, and between and among the healthcare organizations themselves, even those that see themselves in tremendous competition with one another. So in closing, we really believe that the way to address any issue of scarcity, as in scarcity of healthcare human capital, is to approach it from a position of abundance, an abundance of creativity, an abundance of compassion, which is really characteristic of the state, and an abundance of collaborative spirit, which is harnessed in really meaningful ways, as we've seen this morning. So that concludes my reflection. Thank you very much.
Thank you, Tina. I appreciate it. We appreciate you being here, and we appreciate your leadership of FranU and playing such a critical role in our state and our community. Next, we're glad to be joined by Roy Martin, the chairman and CEO of Roy O. Martin Lumber Company, one of the largest private landholders and businesses in Louisiana. Mr. Martin's been a leader in higher education and business, as well as in healthcare. Mr. Martin's been involved with LSU, LSUA, various other institutions, and recently worked together. We recently worked together with LSUA, a program that was mentioned a few weeks ago, on the Sinlaw Nurses of the Future effort. We are glad he is here. And Roy, with that, I'll turn it over to you and just say thank you for joining us. Look forward to hearing your remarks.
Thank you, Michael. I'll definitely give y'all a shout out right at the end here. But for those that don't know me, especially the ones on Facebook, because I'm not on Facebook, my wife tells me all about it. Roy O. Martin is almost 100-year-old company. I'm the 3rd generation CEO. We're in the forest products manufacturing business, forest services business, and grow lots of trees right here in Louisiana and Texas. We have about 1,300 employees and about 2,300 covered lives in our internally run medical benefits trust called MHC EBT. This is a unique situation that we have our plan design that's unique in Blue Cross Blue Shield world. They provide our coverage for all of our employees. And part of this includes a patient-centered medical home right here in Alexandria, Well, one of my employees can walk in for $15, see a board certified nurse, board certified general practitioner, a nurse practitioner. We have a pharmacy with a Pharma D that we buy drugs right from the PBM and do not mark them up at all, selling that to the employees. And they think they got a raise after they fill their prescription, believe me. We have nurses at each one of our facilities, so we can bring preventative care and healthcare right to our employees at our different factories. And they bring their children as well. So it makes it convenient for them to get the healthcare they need. And I can tell you this, through COVID, it's the only reason we were able to run 24 hours a day, 7 days a week. It was amazing how our employees and their families depended upon our medical home and those nurses and doctors that could answer questions in the middle of the night and FaceTime them right at home to say, I got a little sniffles. Do I have COVID? Well, no, probably not. Come in and get tested. And so we were able to provide that. Our medical home is also, we have, I guess, for a fee, allowed other businesses here in Alexandria that have a significant number of employees to pay in to use the medical home and those services. And we have about 4,000 covered lives totaling, and we are about full. As Michael was saying, we partnered with Blue Cross Blue Shield Foundation in a great way last year. We have a acute shortage of nurses in our area. And so we led a consortium, I guess. I made some phone calls to other business leaders and CEOs in my area and raised about $450,000 in about a month to get LSUA's 4-year nursing program unbottlenecked at the clinical side. So we got out and hired a master's degree nurse as an instructor, or 2 of them actually. And Blue Cross Blue Shield Foundation found out about this and came in and matched the $450,000 that we had raised. And we really jump-started that program during COVID, which was really amazing to me. We went from that bottleneck was we had like 88 students waiting for clinicals. And so we were able to open that up almost immediately. And the chancellor at LSUA, Paul Carell, did and Dr. Cormier, the dean there, did a fantastically urgent job of getting that program jump-started. And in just 1 year, their completion rate went from 43 to 75, virtually overnight. All of these students that completed this course got their 4-year degree, and 94% of them passed the boards, and they were employed all in our area, just about all in our area. And so that was a tremendous win for us, the employers, to get nurses to these healthcare facilities, for the community, for LSUA, and it was a great economic development venture that we hope to double again. We are in the process of doing that program again with hopefully with Blue Cross Blue Shield again. So we'll see. And that's what we do at Royal Martin. Thanks.
Thank you, Roy. We appreciate you being here, and we appreciate your leadership on these critical issues and in all the innovative ways you all are meeting the needs of your employees and folks throughout your region. Last, we are glad to be joined here today by Dr. Leo Sawani. Dr. Sawani is the Senior Vice President and Chief Academic Officer at Ochsner. As most folks know, Ochsner is one of our state's largest healthcare providers. It's also an academic teaching set of hospitals and a major employer. They've invested heavily in training nurses, doctors, and providers through their own programs, and they've also partnered in various efforts across the state, of which we've been involved and a couple, and you've heard about a few throughout these sessions. So Dr. Sawani, thank you for joining us. The floor is yours.
Thank you, Michael, and appreciate you having me. Michael, you covered the healthcare workforce crisis and then I think crisis is the appropriate word. And it goes beyond nursing, and Tina covered some of this, lab tech, rad tech, med techs, you name it, you put a tech behind it. We have a critical shortage, surge techs and the likes. We've tried to address this through partnership and some great collaborations that have already been mentioned here. And so I'll just go through some of Ochsner's collaborations and partnerships through this. So on the physician assistant side, we developed a partnership with Xavier University. This January 2022, we took in our first January 2020, and in July of 2022, we'll graduate our first class of 40 physician assistants. Along with Xavier, we're starting a genetic counseling program. It'll be the first genetic counseling program in the state of Louisiana. Bachelor Lab Scientist program and medical informatics program. And we are focusing on diversity through our partnership with Xavier. We partnered with Delgado, made a capital investment to expand their capabilities and committed to provide clinical placements for Delgado. We started a partnership with Loyola University to start a nursing school. We've taken in our first freshman class of around 40 students and into the sophomore class, first year of the nursing school for that. We've got transfers in of about 18 students. We've been partnering with LSU Eunice Fletcher, LSU Health Shreveport, also to look and ULL, also looking at where we can support and help them. We've had talks with UL Monroe. We've had talks with Northwestern, LSU and Shreveport. And again, looking at kind of what Roy covered, what's your bottleneck and where are your pressure points and how we can help you with that. We know it goes deeper than just starting at the university level. So we've developed pipeline programs for STEM. Most of these currently are in the greater New Orleans area. These include our OASIS program that looks at promoting diversity in healthcare careers, including physicians, and our PODER, which is focused on our Hispanic, both high school and mentoring in the undergraduate years, again, for physicians and other healthcare careers. We partnered with Blue Cross Blue Shield, and they've been a great partner with the Kingsley House that looks at, is an organization, a community-based organization that will help identify people who are looking for a career. This particular partnership with Blue Cross Blue Shield is focused on community health workers and patient care technicians. We also have an MA Now program, which is a very successful program, first started just outside of Ochsner's main campus on Jefferson Highway in the Shrewsbury, which is an underserved, impoverished area, neighborhood, where we first moved in and trained 20 medical assistants from the community, of which we employed 16 of those 20 right at Oxford. So these are all very successful programs. And in the big picture, we see this as part of our Healthy State Initiative. As Oxford rolled out in 2020, our commitment to try to improve the health rankings of Louisiana to 40th from the traditional 49th to 50th in the next 10 years. And we know we can't do that without tackling poverty, and we can't tackle poverty without giving people a job with living wage. And what we love about the synergy here and with everyone on this call is that healthcare is a major workforce provider in our state, and there's an incredible need for us to train more of our own. So it aligns perfectly with helping people get out of poverty and helping care for our communities. So we appreciate the opportunity to present today. Thank you, Michael.
Swani, thank you very much, and thank you for all you and Ochsner are doing across our state on these critical issues. We really appreciate it. Well, Dr. Swani, Roy, Tina, thank you so much for your time and insights. And then from earlier, Terry and Shay and Jonathan, thank you for your insights. For those watching the clock, we're almost to the end of our time. And I just want to say thank you all who have participated today, as well as folks who participated throughout these sessions. As we noted at the beginning, these sessions are recorded. The materials will be available after each session. And so we certainly encourage anybody who was not able to catch some part of it, or maybe caught some part but couldn't catch others. watch these videos, follow up later, share with others. Our intention of these sessions was not to cover everything. I could go through a laundry list of things we didn't touch on, whether it's interprofessional education, policy, leadership, technology, pay discrepancies. We could go down a whole list. There are any number of nuances to these issues. Part of why we wanted to close with the example from the team in Northeast Louisiana is we really think it takes multiple partners working together in an ongoing and collaborative way to tackle these issues over time. I think our examples from Fran Yu, from Royo Martin, from Oshner, in ways that they're partnering with others are great examples of how that work can be done in other parts of the state. And we would encourage you all to engage in this work down the road. Those of you who are here on Facebook, see in the chat a link to a survey. We're going to be sending this out via email. And for those on Facebook, we'll be dropping in the chat there as well. That survey has an opportunity for you to give us feedback and to say, hey, here's what I liked or what I'd like to see you cover. But more importantly, it also has an opportunity to say, this is an area of interest for us. Me and our organization are interested in this topic. I would like to engage geographically, topically. Maybe I think there's something I can learn or ways that I can help with others. We would ask that you fill out that survey and raise your hand. Tell us you're interested, and we will pair up groups of people who are interested in this work together. Maybe there's some opportunities to engage in an existing partnership. That would be great. Maybe there's a need to start something new. We think these sort of local and regional efforts are part of how we begin making progress on these issues across our state, and we certainly encourage you all to join together in that. So with that, thank you all for joining us today and over the last few weeks. We appreciate your interest in this. We look forward to partnering with you now and in the months to come. And certainly as we or the Blue Cross Foundation can be a partnership with you in the months to come, please don't hesitate to let us know. So with that, thank you, everybody. Have a great rest of the day.